This episode of GT the Podcast is supported by Alcon.
This is Ike Ahmed.
And I'm Arsham Shaybani.
And we want to welcome you to GT the Podcast.
We're bringing this to you together with BMC and Glaucoma Today,
to offer audible insights into current topics in glaucoma care.
Presented by the authors of our latest, most read GT articles.
Check it out.
Welcome to GT the Podcast. In this episode, Dr. Leonard Seibold recaps his article, Physician Burnout in Ophthalmology, written with Dr. Jessica Sedhom and featured in the September-October issue of Glaucoma Today. The article discusses burnout syndrome and its increasing prevalence among physicians, as well as results of a survey to determine burnout rates among ophthalmologists and identify the major risk factors for burnout syndrome. Here's Dr. Seibold.
The term burnout, coined by psychologist Herbert J. Freudenberg, Ph.D., first appeared in psychiatric journals in 1974. While working in free clinics, Dr. Freudenberg observed his patients lighting cigarettes and forgetting entirely to smoke them, instead watching them burn out. The term also aptly describes the exhaustion that many medical professionals currently feel. Burnout syndrome is a pervasive diagnosis among doctors. Its prevalence varies greatly among specialties. The 2020 Medscape National Physician Burnout and Suicide Report stated that the overall rate of burnout syndrome is as high as 43%. In 2019, the World Health Organization added burnout syndrome to the 11th revision of the International Classification of Diseases. The organization defined burnout syndrome as the result of chronic workplace stress that has not been successfully managed, and identified three characteristics: feelings of depleted energy or exhaustion, increased mental distance from or negative or cynical feelings about one's job, and reduced professional efficacy. Among physicians, burnout syndrome is associated with an increased risk of alcohol abuse, depression, and suicide, but the risks extend beyond the physicians themselves. A higher incidence of medical errors, an elevated financial burden, and poor patient care have been implicated as major consequences of burnout syndrome in doctors. Burnout syndrome among ophthalmologists specifically is largely understudied, probably owing to misconceptions that ophthalmologists have higher physician satisfaction, a less stressful work environment, and a generally more favorable lifestyle than practitioners in other medical specialties. Ophthalmologists, however, may be just as susceptible to burnout syndrome as their colleagues in other specialties. Previous studies of ophthalmologists indicate that career stage plays a role in burnout syndrome, with the highest rates of burnout syndrome found among those who are in the early stages of their careers. For example, a Saudi Arabian study found that 41% of ophthalmology residents experienced emotional exhaustion and depersonalization. In the United States, 63.3% of ophthalmology residents reported at least one symptom of burnout syndrome. Another study looked at department chairs in ophthalmology and found only 9% reported experiencing burnout symptoms. Together, these data suggest that burnout syndrome may be most pervasive among ophthalmologists who are in the early years of their careers. Recognizing the symptoms of burnout syndrome during ophthalmologists' medical education and providing them with the tools to address it could help to alleviate their burden in the present and future. We recently surveyed U.S. ophthalmologists for symptoms of burnout syndrome using listservs for several national ophthalmology societies. We identified a burnout rate of nearly 37% in the 592 ophthalmologists who responded. Broken down by subspecialty, burnout rates ranged from a low of 30.8% for vitreoretinal specialist to a high of 45.4% for uveitis specialist, but no subspecialty was immune. The high prevalence testifies to an unsettling normalization of burnout syndrome in medicine. Among those experiencing burnout syndrome, further categorization revealed that the burnout was mild, moderate, and severe in 65.2%, 29.5%, and 5.4% respectively. Our study identified two major risk factors for burnout syndrome. The first risk factor, sex. female ophthalmologists reported experiencing burnout syndrome at significantly higher rates than male ophthalmologists, 46.2% versus 31.2%. Based on the peer-reviewed literature, this disparity is not unique to the United States or ophthalmology. In a study conducted in India, 25.2% of ophthalmologists reported experiencing burnout, but female ophthalmologists reported it at a considerably higher rate of 68.4%. In another meta-analysis, physicians were at 1.44 times greater risk of suicide than non-physicians, with female physicians at an even higher mortality rate of 1.9. Gendered expectations in the relationship between patients and physicians may contribute to the differing prevalence of burnout syndrome among female and male physicians. One study found that female physicians on average spent more time counseling patients, resulting in a reciprocal cascade of subsequent visits with time pressure, discontinuous workflow, and overall stress. Another study pointed to sexual harassment and workplace discrimination as contributing to burnout. Still, other researchers have speculated that differences in reporting burnout may be a factor. One meta-analysis indicated that women were more likely to report the category of emotional exhaustion, whereas men were more likely to report depersonalization. The reason for a higher rate of burnout among female physicians is likely a combination of these factors, as well as others. Burnout syndrome risk factor number 2, employment, autonomy, and type of practice. Compared with those working in private practices, ophthalmologists employed by hospitals reported higher degrees of burnout. This finding is in accordance with the results of previous studies that showed a positive correlation between hospital-owned practices and burnout rates, even after controlling for personal characteristics. Ophthalmologists employed by hospitals are quickly supplanting private practice doctors in the United States. In 2020, the American Medical Association's Physician Practice Benchmark Survey found that, for the first time, less than half of physicians worked in a private practice, down from 60% in 2012. Meanwhile, the number of employed doctors rose from 41.8% in 2012 to 50.2% in 2020, a trend that appears to have accelerated in recent years. It is therefore critical for hospital systems and academic institutions to recognize the drift away from private practice and the increased risk of hospital-based physician burnout, because burnout syndrome is specifically a work-related condition. There is increasing urgency for large hospital systems to address burnout syndrome and implement methods to mitigate its drivers. Programs that use scribes, endorse physician health and wellness programs, and encourage team workflow may be better positioned to address this phenomenon. Burnout syndrome is an increasingly prevalent problem in medicine, with more than 1/3 of ophthalmologists reporting at least mild symptoms in our study. Physicians who are female or employed by a hospital appear to be at highest risk of experiencing burnout syndrome. Studies that explore the drivers of burnout are needed, ultimately followed by research on ways to prevent and treat burnout syndrome.
Thank you for tuning into this episode of GT the Podcast. If you have any feedback or topic suggestions, find us on Instagram, LinkedIn, Facebook, or Twitter. And stay tuned for more hot topics in glaucoma care on GT the Podcast.